And for me, I probably couldn't get into medical school nowadays because my essay would be, I just want to help people, which is really the reason why I went into medical school. That really has been driving me forward. That care of people, making their lives better, of improving the life of the child that's in front of me, I really think has been the driving force behind my career.
I've worked with Jose for many years on areas of pediatric infectious diseases, where he assisted the Arkansas Department of Health. I also worked with him together on the Advisory Committee for Immunization Practices of the CDC.
I've known Jose for almost 15 years. He came to Arkansas to take over the infectious disease program from me at the Children's Hospital.
There are very, very few who have his diversity of scientific and medical background, but also together with a really wonderful and kind person who really cares for children.
Jose's lived in a lot of different places. He was born in Mexico, raised in California, did a lot of his training in New York and Colorado and in Nebraska, and then came to Arkansas with this vast array of experiences and perspectives. And I think that's given him insights that have contributed so much to the positive directions that he's brought in his role as Secretary of Health.
Working on things like pediatric HIV, pediatric tuberculosis, to his work in vaccinations, immunization.
He's got an incredible sense of justice, and I think that's driven a lot of his work to make sure that all kids in Arkansas got the health care that they deserve.
Both his leadership within the state and his national and international leadership have made a profound impact on improving the lives of children everywhere.
He brought the children's eye to that role and has always been the #1 defender of kids in making sure that they got the care, diagnostics, and treatment they needed during this pandemic.
As a friend, a colleague, a parent of a patient, I appreciate his incredible knowledge and his energy. Now, I had a conversation with my daughter earlier this morning about what she likes about Dr. Romero, who she considers the best doctor in the world. She said, really, the fact that he's understandable.
Well, Jose, it's been great to be a friend of yours for the last few years. And I want to thank you for being an enormous friend of the children of Arkansas. You've made incredible contributions to the health of our next generations, and we're all deeply grateful for that. Thank you so much.
Jose, job well done. Thank you for all that you've done for the children of Arkansas, for the children of the United States, and for the children of the world. It's an honor and a privilege to call you as a colleague and a friend, so thank you for all you do.
Public health to me has been an extension of being a physician. As a physician, you want to make the life for somebody better. You want to improve their situation. When you work with the families, to give them a better life, to help the family and the child, that is extremely rewarding. And I've been very lucky. I mean, I've always said that to students and to undergraduates that I've had many careers in the course of my academic lifetime. Thank you, the people of Arkansas, for allowing me to contribute in some way to your health and well-being.